Hello, everyone. I'm very glad to have this opportunity to study with you. And I'm your pharmacology new teacher, 刘老师, Liu Chunna, my Chinese name. And my last name Liu, my first name Chunna. And you stay in China about 6 years. Only one teacher will teach you 2 years. This is me. So I'm sure you will remember me. I'm very glad to have this special situation to study with you. I'm the professor, the youngest professor in our university. So I have taught you pharmacy students more than 10 years. This semester, we will study pharmacology, and the next year, I will teach you clinical pharmacology. So you have studied pharmacology about 2 months. And do you know we divide pharmacology into 7 parts? The first part, we call this general principles. And in this part, you have studied 4 chapters. Introduction, and then you studied pharmacokinetics and pharmacodynamics. This is the first part of pharmacology. And the second part in pharmacology, we call this drugs acting on efferent nervous system. Do you remember the last teacher have taught you alpha and beta receptors agonist and antagonist? And you also studied M and N receptors agonist and antagonist. So you studied adrenaline, noradrenaline, propranolol, atropine, neostigmine in this part. This is the second part. And last month, you have studied the third part of pharmacology. We call this part drugs affecting central nervous system. So in this part, you study the NSAIDs, non-steroidal anti-inflammatory drugs, aspirins, and you also study the analgesics, morphine, and then you also studied how to treat Parkinson's disease, epilepsy, and you also studied how to treat schizophrenia, mania, and depression. So we call this the third part in pharmacology, central nervous system. From this class, I will study with you. We will study the fourth part in pharmacology, drugs affecting on cardiovascular system. And later I will explain for you. In cardiovascular system, we will study how to use basic agents to treat common disease in cardiovascular system. And then next month, we will study the fifth part of pharmacology, drugs affecting on visual functions. In this part, you will study how to treat gastric ulcer, how to treat asthma, and some drugs inhibit coagulation, heparin and warfarin in this part. And the sixth part in pharmacology, we call this endocrinal system. In endocrinal system, you will study 3 hormones. The first hormone, the most important drug in pharmacology in clinic, it is glucocorticoid. So we will study hydrocortisone, dexamethasone. They are glucocorticoids. And then the second hormone is thyroid hormone. And in this hormone, in this chapter, we will study how to treat hypothyroidism and hyperthyroidism. And the third hormone is insulin. Oh, that means we will study how to treat hyperglycemia and hypoglycemia. So the last hormone, we will study how to treat diabetic mellitus. The last part in pharmacology, we call this chemotherapy of microbial disease and malignant tumors. So the last part, we will study lots of antibiotics and antiviral, antifungal drugs. Okay, so now you have known we will study 7 parts in pharmacology, and this class we will study the first part. Let's continue the class. The first part, the drugs affecting on cardiovascular system. In cardiovascular system, very easy. We will use and study 4 basic agents. They are the first kind, CCV, calcium channel blockers. Later, in this class, we will study CCB, calcium channel blockers, pharmacological effects, clinical using, and error section. And then, today, next class, we will study the second basic agents. They are 2 inhibitors in renin-angiotensin system. These 2 inhibitors, they are ACEI and ARB. The full name of ACEI, we call them angiotensin converting enzyme inhibitors. And we also will study ARB. The full name of ARB, we call them angiotensin 2s, the first receptor blockers. So in this part, we will study captopril and losartan and so on. These drugs can inhibit renin-angiotensin system, and these drugs are commonly used to treat heart and vessel disease. The third commonly drug you have studied, and diuretics. Do you remember? We also divide diuretics in accord with their efficacy, divided into 3 kinds: high efficacy, moderate efficacy, and low efficacy diuretics. Yes, they are basic agents, and we will use them to treat cardiovascular system disease. And the fourth commonly disease, fourth basic agents, they are beta receptor blockers, and in clinic, we use high selectivity beta-1 receptor blockers, and you have studied these drugs, such as propranolol, metoprolol, atenolol, esnolol, and so on. And these 4 kinds of basic agents, there are 4 kinds of basic agents, and are very widely used in clinic to treat cardiovascular system disease. So later in cardiovascular system disease, we will study how to treat the first disease, angina pectoris. And then we will study how to treat arrhythmias, tachycardia, and bradycardia. And then we will use these 4 basic kinds of agents to treat the most common disease in cardiovascular system. We will study how to treat hypertension. At last, in cardiovascular system, and we will study how to use these 4 kinds of basic agents to treat chronic heart failure, or we also call this congestive heart failure. So that means in cardiovascular system, we will study 4 basic agents to treat 4 common disease. So let's begin our new class. Let's study the first common disease, CCB, calcium channel blockers.